Welcome to those who have just joined. We have a few folks still connecting. We'll get started. And I'm Jenny Miller, the Executive Director of the Global Climate and Health Alliance, and I'm very happy to welcome you to our debrief about COP29, which took place last month, and with a perspective on what COP29 means for health, what the outcomes mean for health, and where we go from here. I want to point out that we have translation into Spanish as well as into Russian, Spanish English interpretation, and Russian English interpretation. We had late requests for French, and unfortunately we do not have French today. And I wanted to thank our partners at Eco Accord for providing the Russian translation on today's meeting. So I'm gonna, in a moment, I'll run through our agenda for today. I'd like to note that we have a very packed agenda. We're gonna strictly ask our speakers to stick to their allotted 5 minutes because we have quite a number of topics to get through to cover the whole of COP29 and implications for health. And we will pause at a couple points along the way for Q&A. So there will be 3 Q&A breaks, I believe. And so after every few speakers, there'll be a time where our attendees can jump in and ask questions. I also want to encourage everybody who's on this call to share your own intel about COP29 and your thoughts about where we are going, should be going from here in the chat while the presenters are speaking during the Q&A throughout the meeting. There's a wealth of knowledge and expertise amongst the folks who are with us today, and we really would love to have your insights shared with everyone as well. So I'm now going to run through our agenda for the day. Sorry. So Milena, if you could go to the next slide, please. So we're going to open by turning to GCHA's Vice Chair of our Board of Directors, Dr. Courtney Howard, to provide some overall reflections on COP29 and its implications. And provide some context for the rest of the meeting. We'll then turn to Jess Beagley, GCHA's policy lead, for reflections on finance. GCHA's policy coordinator, Michelle Baker, will talk about mitigation and the outcomes on mitigation. We'll then turn to Milena Sergieva, our GCHA's liaison officer for Latin America and the Caribbean, to talk about adaptation outcomes. Christina Arnaz Sanz from the Yale School of Public Health and a member of the Youth Climate and Health Network, which GCHA coordinates, will be speaking about loss and damage. Another Youth Climate and Health Network member, Winifred Akello, who is a student of veterinary medicine at Makerere University, will be speaking about the agriculture outcomes. Dr. Logan Harper will speak about just transition. Logan is a Climate and Health Science Policy Fellow at the University of Colorado and also doing a preceptorship with us here at GCHA. And Niona Nakuya Kasakende will be speaking about gender. She is the Gender, Health, and Environment Lead at Regenerate Africa. We'll turn back to Jess Beagley and Jen Kuhl, GCHA's Networks and Engagement Lead, to talk about the non-negotiated components of COP29, health announcements, and also looking ahead to COP30. So with that, we will in a moment turn to our first speaker. And again, just a reminder to our speakers to keep your remarks to 5 minutes, and also to speak slowly to enable our translators to keep up with you and provide the interpretation. So with that, I'm delighted to turn over to Dr. Courtney Howard.
Hi, everyone. Thank you so much for joining us today. I'm speaking from Chief Dry Geese Territory in the subarctic in the country we call Canada. This land has been traditionally stewarded by the Yellowknives Dene, the Welliday Dene, and the North Slave Métis. And I want to emphasize where I'm speaking from because, as health professionals, I'm an emergency physician. I've lived here for about 13 years. Really, it is part of our official mandate for me within the College of Family Practice of Canada to speak on behalf of our patient population. This part of the world is warming at over triple the global rate. We are already 2.5 degrees Celsius warmer than we were when an elder of about 80 years old was born. And we're also downstream from the oil sands. And I get a lot of questions from elders at my hospital and in the community around that. Does that impact my health? And so I want to connect the micro individual level work that we do as health practitioners on the ground with the very macro level work that we do at the Global Climate and Health Alliance at on the world stage, because I think it's important that we understand that what happens at COP is really in some ways a reflection of not only what happens around the table in these negotiation spaces, but of everything that builds into that moment, because that will affect what we do as the health community coming out of it. As a health practitioner, working on the front line, we know that health systems are strained around the world. So, to give you a sense of my last few days, I worked overnight on Saturday night. And on Sunday morning, after sleeping for 3 hours, had MLA over for lunch with other physicians on the executive of the Northwest Territories Medical Association board to talk about a primary care crisis. And so you can see that in order for us to truly muster the trusted voices of health professionals speaking on behalf of our communities, we need to organize ourselves as a policy and advocacy and organizing network so that we can meet them where they are, which is either at the bedside or not far from the bedside, in order to really achieve the power we need to see the outcomes we want. Because the work they do in their communities is what helps them to help their communities understand what is sustainable healthcare. Why do we need to decarbonize the electricity supply in order to save lives from air pollution? That work then lends political space to the leaders at the subnational and national level that they then give to their negotiators to use around the table. And so I think what we saw at COP, and we'll hear in very good detail after this, so I'm not going to go into any details about the negotiations, was that we didn't see the outcomes that we wanted. There were some bright lights, but for the most part, it was disappointing. And although within the health sciences, we like to focus on evidence, we go bedside to bedside and say things like, well, what is the evidence for that study, for that particular antihypertensive young MSI, young intern? What we in fact use to make many of our decisions is story. Story is based on feeling. And so we need to be really accessing evidence not only from the health sciences and the natural sciences in our work, but also the social sciences. So the social sciences help us learn how to communicate better with our policymakers. They help us learn how to negotiate effectively. And I think what we saw at COP was, in fact, a lot of very encouraging work on behalf of the health sector. We had really a turning point at COP26. And I feel like we have continued to move on in terms of mainstreaming sustainable healthcare into our health systems. The attached meetings were very, very positive. We had many learnings at the World Health Organization Pavilion from one another. So I feel like within medicine, within what we're doing in the health sector, things are moving forward. I feel like you can even see by virtue of the many speakers we have speaking to the different negotiation streams, we're ever more skilled in terms of how we can analyze the different negotiation streams. Where I feel that we could do better is in training these very busy health practitioners that we have to go advocate at the community level to create the political space that at the end of the day shows up as the willingness of high income nations to allocate more finance, shows up as an awareness of what adaptation actually means for health systems. My health system was evacuated due to wildfires in 2023. And to be honest, our entire community and our health professionals are still recovering from that. And so, heading in as we take these very exciting and detailed analyses from our further speakers, what I'm going to be listening for is okay, so how do we, as the Global Climate and Health Alliance, who has this network of networks expanding with reach into many countries worldwide, we've previously mobilized over 40 voices representing over 40 million health professionals to bring the power of health to this work. How do we do that in a way that counters the fossil fuel industry, that counters other voices that are arguing for the status quo in a way that speaks to previous work we've done, that speaks to the success of the Convention on Tobacco, that speaks to work we've done in countering the influence of the pharmaceutical industry at the bedside. So taking a very commercial determinants of health lens, looking to organize as well as we can, looking to train our advocates as well as we can, because we know that really one of our greatest assets are these trusted health professionals, trusted because they do the work in their communities, but at the same time, knowing that they need the help of a very experienced and well-organized secretariat to really muster the voice of health in order for us to deliver the healthy future and the good negotiation outcomes we want in the future. So thank you very much. Looking very much forward to the rest of these speakers. So proud of the Global Climate and Health Alliance team and the physicians and other health professionals who came to COP and did the work.
Thank you so much, Dr. Howard. Great intro to the rest of what we're going to talk about today. So now, quickly, I'd like to pass on to Jess Beagley, GCHA's policy lead, to drill into the finance outcomes from COP this year and tell us what happened and what it means.
Thanks, Jenny, and thank you, Courtney, for kicking us off so beautifully. To explain a little bit about why climate finance is relevant for health, I think often we can feel that climate finance might be quite remote from health, but at the most basic level, we are not going to be able to implement and deliver climate action without finance. And that applies to any sector, whether it's energy or transport or agriculture or sanitation or health or buildings. And we know that action across all of those sectors is going to have a really strong emphasis and influence on health, because if we don't have resilient agriculture, we won't have nutrition security. If we don't have resilient sanitation, we won't have water security. If we don't have mitigation across all sectors, we're at very real risk of increasing health hazards and even of exceeding the limits of adaptation. So all climate finance is going to be very positive for health. We also know the way climate finance is delivered is essential. At the moment, a large amount of climate finance is delivered via loans and not through grants. And the challenge with this is that the debt that is incurred as a result of the interest rates of those loans is incredibly detrimental to human health. And we know that when countries are pushed into debt, that individual households are also pushed into debt. And we know that poverty and health are inextricably linked, and that people that come from backgrounds of poverty are much more at risk of adverse health outcomes, including adverse health outcomes of climate change. We also know that in the poorest countries in the world, that countries are currently paying more on debt service than they are able to invest in healthcare and infrastructure. And finally, we often hear that the level of climate finance that is needed is really, really high. But actually, this money is available and it's just currently invested in health harming activities. So at the moment, over $1 trillion every year is invested in fossil fuel subsidies. The investments in those fossil fuel subsidies then create health and environmental and social costs that are in excess of $5 trillion every year. So by adjusting those kinds of financial flows, we can make huge health savings. So the Global South has been really clear since June that it needs $1.3 trillion annually in climate finance. There's also been wide recognition on the importance of this being public and grants-based finance, so from countries and based on grants. There are also strong demands, both from civil society and from some governments, that there would be sub-targets within this overall climate finance target, this overall quantum, the 1.3 trillion, that would include sub-targets for adaptation, for loss and damage, and mitigation. And this is because historically climate finance has been quite focused on mitigation, but actually adaptation and loss and damage are what the Global South need most urgently right now. So in Baku, we saw divergence around what the quantum could be. And in fact, divergence implies that there were differing opinions, and actually developed countries just failed to put a number on the table. While the Global South has been very clear that it needs this 1.3 trillion, the Global North was really hesitant to engage meaningfully in discussions. There's also been a lot of divergence around the source of that finance and whether that should be based on public finance or whether it should include reallocation of fossil fuel subsidies or should include private sector finance. And the fact is that only governments are accountable under the UNFCCC process. So while it's very nice to talk about private sector finance in the UNFCCC, the private sector is not accountable. And then finally on quality and the importance of this finance being grants-based and highly concessional loans rather than high interest loans. Next slide, please. So in terms of the outcomes that we saw, rather than this agreement that, as what the Global South was hoping for, rather than having a commitment by developed countries to provide 1.3 trillion US dollars a year, there was actually language on a goal of 300 billion US dollars per year by 2025, and rather than coming only from developed countries, it's going to come from a variety of sources, including public and private, bilateral and multilateral, including alternative sources. So rather than this being about provision by developed countries, it's ended up being about mobilization, which is far weaker. There is language on the 1.3 billion, but it's not something, 1.3 trillion rather, but it's not something that developed countries have had to commit to. It's just name checking that quantity. There is language around acknowledging the need for public and grant-based resources and highly concessional finance, but again, it's acknowledging the need, it's not a commitment. There was also no mention of those sub-targets on mitigation, adaptation, and loss and damage, and even the 300 billion only refers to mitigation and to adaptation. Loss and damage is mentioned much later in the document. And also the language in the text was watered down, and there was, in an interim version, language on the right to health, on fossil fuel subsidies, polluter pays principle, but that was actually removed. And the last thing I want to say about the 300 billion is that it's barely in line with inflation. So back in 2009, developed countries committed to provide developing countries with 100 billion US dollars a year by 2020. If you look at inflation and from 2020 you move to 2035, that 100 billion would already have been equivalent to 208 billion. So the increases that we're seeing are really minimal, and the accountability is just not there. In terms of next steps, there is language in the text that was adopted on a roadmap to 1.3 trillion and how this much more ambitious and appropriate goal can be achieved. So this is really where we need to turn our attention. And as part of that, it's really key that the health community continues to advocate for scaling up public and grant-based finance, and also looks at the issue of fossil fuel taxation and subsidy reform. And I will pass back to Jenny. Thanks, Jenny.
Thank you so much, Jess. Moving quickly on to our next speaker, I will turn to Michelle Baker, GCHA's policy coordinator. Michelle is dedicated to promoting policies and actions to advance climate action for health protection. Over to you, Michelle, to talk about mitigation, including Article 6.
Thank you, Jenny. So as Jenny said, I'm the policy coordinator of the Global Climate and Health Alliance. And at COP29, I was following mainly mitigation. So firstly, I'd like to start by discussing the relevance of mitigation to health. So climate change causes poor health outcomes such as excess heat, excess deaths, flooding, migration, which also leads to substance use disorders, mental health conditions. It also leads to air pollution and more. And of course, as we know, fossil fuels are the biggest contributor to climate change, causing approximately 5.1 million deaths per year just from air pollution alone. So therefore, mitigation is essential to addressing the health impacts of climate change. And with mitigation, we would see health benefits across all sectors, including clean air, healthier diets, and increased physical activity. So heading into COP, of course, we had an array of different hopes that we would have liked to see. And so some of these hopes included seeing the implementation of the energy transition commitment paragraph of the global stocktake. So paragraph 28, which spoke to a transition away from fossil fuels in energy systems in a just, orderly, and equitable manner. Additionally, we of course hope to see the inclusion of health in text to definitely increase the strength of the case for mitigation, to provide further evidence, further support for moving forward with mitigation. And also we hope to see developed countries mitigating farthest and fastest and protection of vulnerable communities. So a major issue of divergence was the disagreement among parties regarding what we spoke about earlier, paragraph 28, and the inclusion of the GST outcome in the mitigation text. If that was included in the mitigation text, then that would lead to the mitigation work program being a space for implementation and follow-up on the transition away from fossil fuels. And so this was a major area of disagreement among the parties. And unfortunately, they were not able to come to an agreement on this. Next slide, please. So outcomes. There are mitigation outcomes that we observed across different negotiation streams, but I'm going to touch on just 3 of them today. So firstly, the mitigation work program. As I just mentioned earlier, the energy transition follow-up was blocked. This was redlined by certain countries, certain parties that strongly disagreed and objected to the inclusion of the energy transition in the mitigation decision text. We also saw discussions around a digital platform. So there's discussions around a digital platform to basically coordinate and implement mitigation actions. And so this was noted in the decision text. And then moving forward to the UAE dialogue, we did see a draft text for the UAE dialogue that did at one point refer to the energy transition, but it also reaffirmed a role for transitional fuels, meaning gas. And so at the end of the day, this text was not adopted, and it was postponed until the meeting of the subsidiary bodies in June. Lastly, we have Article 6. So for Article 6, countries did agree to major aspects to govern carbon markets. These have been under negotiation for nearly a decade, but there were questions as some of the aspects were quickly gavelled through on the first day of COP. So there are some sentiments that there was just not enough time for discussion around some of these aspects that were just quickly adopted on the first day. And so there is just a little bit of disagreement and concerns around Article 6 remaining. So next steps of the MWP. Submissions. So we will have submissions which will be due on the 1st of February. So parties are encouraged to submit their ideas, their topics, their suggested topics in line with the MWP to be discussed at the global dialogues this year. Also, the digital platform that I mentioned earlier, parties are also encouraged to submit their views on how the platform should be designed, what features the platform should have, and they're also encouraged to submit these by May 2025, a month before the global dialogues, where they will discuss and exchange their views on this digital platform. Lastly, what are the health community priorities moving forward? So firstly, there is a proposal for the 2025 dialogues to include a focus on short-lived climate pollutants. So these include things like black carbon, tropospheric ozone, and methane. And the reason why these are important to address is that they do have a shorter span in the environment. So while carbon dioxide would live in the environment for approximately maybe 100 years, these short-lived climate pollutants would exist in the environment for a shorter time, like perhaps like around 20 years. However, while they exist for a shorter time, they do massively increase the heat and warming of the atmosphere even more than carbon dioxide. So even in that shorter time, they massively increase the global warming. So these are important for us to address, and this could help avert near-term warming and provide significant gains from reduced air pollution. Lastly, of course, we would just want to continue to advocate for inclusion of health impacts and opportunities in future decision texts to continue building that case for climate action. Thank you.
Thanks so much, Michelle. So coming up next, we're going to turn to the question of adaptation and the outcomes around adaptation. And to learn about this, we're going to hear from Milena Sergieva, GCHA's Liaison Officer for Latin America and the Caribbean, and also someone who has followed the adaptation negotiations quite closely. So over to you, Milena.
Thank you so much, Jenny. Well, for adaptation, the health sector stands at the forefront of the climate crisis, with growing threats such as extreme weather events, climate-sensitive diseases, and mental health challenges. Building resilient health systems so is critical to ensure that we can respond effectively without being overwhelmed. However, in adaptation as well as in mitigation, action cannot stop at the healthcare alone. So addressing health determining sectors such as agriculture, sanitation, and infrastructure is essential to safeguard public health and prevent cascading impacts on already strained systems. So the health community approached COP29 expecting some clear and actionable outcomes. Under the Global Goal on Adaptation, the GGA, expected further guidance for technical experts as well as a well-defined work plan for the UAE Belém program, including clear roles and deliverables, establishing health-focused indicators with disaggregated data to monitor inequalities and truly address the needs of vulnerable populations. We also needed means of implementation indicators in within the indicator pack, covering finance, technology transfer, and capacity building to track the support needed for adaptation. And also we advocated for inclusive processes integrating indigenous and local knowledge. Also, the finance gap was a concern for the health community. So the health community supported the creation of a sub-goal on adaptation under the NCQG. At the national level, we recommended that countries develop or update their national adaptation plans by 2025, aligning with the next global stocktake, so that climate resilience planning is based on robust vulnerability assessments. There were a few divergences in the negotiations on means of implementation indicators and how to drive transformational adaptation that goes beyond incremental measures. And at COP29, some progress was made on the Global Goal on Adaptation, improved guidance for experts, and updated indicator criteria agreed upon. A particular focus was given on cross-cutting indicators such as education and the health of children and young people. The Baku Adaptation Roadmap was launched, and the GGA was confirmed as a standing agenda item for future COPs, so that this ensures ongoing attention. Discussions on means of implementation, such as finance, technology transfer, and capacity building were contentious, but ultimately led to an agreement that these would be included in the final set of indicators to be reviewed at COP30. Instead of literally means of implementation, the text emphasized the importance of enabling factors, including means of implementations like finance, technology transfer, and capacity building, along with governance and transparency. The inclusion of traditional, indigenous, and local knowledge in the adaptation process was also highlighted. Both incremental and transformative adaptation approaches were recognized as essential for safeguarding the well-being of people and planet. And the new text on the national adaptation plans was not finalized at COP29. Further deliberations will happen in June in Bonn. The Nairobi Work Program that has a knowledge hub for adaptation and a program on knowledge gaps is to develop guidelines of indigenous knowledge. Can I ask you to mute yourself, please? Thank you. The adaptation fund text calls for fulfilling the pledges for $300 million annual, a target that was set in 2024, and a renewed pledge from Germany for 60 million euros. And looking ahead, the GGA will focus on refining the indicators, with hybrid technical workshops planned before June 2025 and a report coming out of that. By COP30, experts will finalize a set of indicators, not more than 100, to assess progress towards enhancing resilience and reducing vulnerability. There are at least 7 health experts within the expert group. Additionally, the Baku adaptation roadmap will guide the progress in line with Article 7 of the Paris Agreement. And health communities' priorities continue to be health indicators, adaptation finance for health, health in apps, locally led, inclusive health and adaptation, early warning systems, of course, and strengthening health governance for adaptation and capacity building. Thanks so much.
Thank you, Milena. So we have one more speaker before we'll open up for our first round of questions. So if questions have been emerging for you, please make a note of them and be prepared to kind of jump in and ask them in a few minutes. But before that, I'm going to turn to Cristina Arnez Sanz to talk about loss and damage at COP29. Cristina is a Master of Public Health student in Epidemiology of Microbial Diseases at Yale School of Public Health, concentrating specifically on climate change and health. And she is also a member of the Youth Climate and Health Network, as well as the Health Working Group of Youngo. So over to you, Cristina.
Thank you, Jenny, and thank you, everyone. Hello, it's very nice to be here to share the main outcomes of COP29, specifically related to loss and damage. So first, as you probably know, despite mitigation efforts to reduce greenhouse gas emissions, as well as efforts to adapt to climate change, the impacts of the climate crisis result in devastating losses and damages that disproportionately affect the most vulnerable populations of developing countries. And these are actually classified into economic and non-economic losses and damages. The non-economic ones include sudden and long-term impacts on health and well-being, such as increased mortality and morbidity due to heat-related illnesses, for example, infectious diseases, and poor sanitation, water, and hygiene. Now, if we turn to the main expectations related to loss and damage ahead of COP29, first, we can mention that we were hoping for the inclusion of sub-goals for addressing loss and damage in the NCQG, particularly through grants. Second, we looked forward to the review of the Warsaw International Mechanism for Loss and Damage, the WIM. Some of the high-level expectations were to provide clear guidance for its executive committee, expert groups, and the Santiago Network to meet the needs of developing countries. And lastly, securing more pledges for the fund for responding to loss and damage. However, progress at COP was hindered by several issues of divergence. First, there was debate over whether the NCQG should include these specific sub-goals that I mentioned earlier. Then, within the review of the WIM, there were different disagreements. Just to mention 2 of them, creating a regular report on the state of loss and damage was discussed, and another one was over whether to develop guidelines for integrating loss and damage into the nationally determined contributions, NDCs. And finally, a long-standing unresolved issue emerged again, and that is the governance of the WIM. Developing countries advocated for governance under both the UNFCCC and the Paris Agreement, while developed countries wanted governance only under the Paris Agreement to limit liability. And this is a repeated issue that's postponed usually to the next COP. And if we move on to the next slide, we will go to the outcomes. So that's probably the most interesting part, what happened related to loss and damage. So on the NCQG, unfortunately, there was no concrete provision of finance for loss and damage, as Jess mentioned earlier. The only thing we got was that the outcome text acknowledges, that's the verb used, the need for grants and concessional finance for loss and damage, and it recognizes that there are significant gaps in addressing these needs. Then regarding the fund itself, there were 3 key documents signed about the administration of the fund, and this signaled the start of the 4-year interim period, hosting period at the World Bank. There were also some new pledges from Sweden, Australia, and New Zealand, which brought the total funding to almost $750 million. And this is some progress, but still far below the estimated need of $400 billion a year during this decade. Then the parties considered the first report of the board of the fund, completing some milestones of logistics to operationalize fully the fund. And the parties provided guidance, including, for example, importantly, the urgency of converting the pledges into contributions. Then, if we discuss more of the WIM itself, there was the review of the WIM and the joint report of the WIM Executive Committee and Advisory Board of the Santiago Network. These were 2 items that were negotiated together under one agenda item. And unfortunately, there was no agreement. Both decisions were postponed to Bonn, SB 62, and also the issue of governance of the WIM that I told you earlier was postponed to COP30. There was a little bit of progress, and that was that under this agenda item, they adopted the rules of procedure of the Santiago Network. And before we move on to the next steps, earlier this month, there was the 4th board meeting of the fund, which took place in the Philippines, and it focused on adopting a roadmap with some relevant issues for CSOs and civil society. So next steps, looking ahead, we have Bonn, SB 62, and COP30. In Belém, the annual review, the annual report and the review of the WIM will take center stage again, and countries will submit NDCs ahead of COP30. So it will be important to see if they include loss and damage. And in April, there will be the 5th board meeting of the fund and the first annual high-level dialogue in the World Bank. And as about the priorities for the health community, some of them will be for sure looking at the NDCs and the biennial transparency reports, see if the countries include loss and damage, and if they do, are they integrating explicit health considerations? That's what hopefully we would advocate for as the health community. Then we hope that the WIM's next 5-year mandate integrates health, and we can continue to advocate for an annual or biennial assessment report on the state of loss and damage, which could include a dedicated chapter for health. And finally, the Santiago Network, it should include health experts to be able to provide technical assistance to developing countries focusing on the health impacts of climate change, and the fund for loss and damage must adequately include health in the programmatic approaches. Thank you.
Thank you so much, Christina. So we're now going to pause in our lineup of speakers and allow for a few minutes of questions from the field. Does anybody have a question that they'd like to ask or a reflection that they'd like to make? Yes, Dr. Cruz, please unmute and ask your question or make your comment.
Thank you. Hi, Dr. Serena Cruz. I'm with the Global Surgery Umbrella. I really appreciated the comments that were shared, especially the agenda that was being mentioned, that what to look for and what could come, and the question of whether what or which aspects or parts will include health. From a global surgery perspective, we talk about 2 things that are essential for the delivery of safe, timely, and appropriate care, and that are the number one medicine that we always need is oxygen, because we can't do surgery without oxygen. And we also talk about the fact that surgical systems are a great measurement to look at the larger safety and wellness of a system, a health system in general. And my question is, NCDs are important, and there are medicinal ways to address them, but they are, by and large, often are going to require a surgical component to the treatment. And what can be done to look at disease burdens with surgery in mind when you're talking about health and how to finance it, as well as think about it from a climate sustainable and resilient perspective?
Yeah, Jess.
And sorry, Jenny, if you wanted to take questions in groups, there's a couple in the Q&A box as well. So I'll answer this one, but if you want to organize things differently, please
Okay,
do.
yeah, please go ahead and yeah.
Thank you. To respond to Serena, I think there's a real need to look both at how we can optimize climate finance for health outcomes, and that's discussed under the UNFCCC, but also there is development assistance for health, there is health financing out there. And I think we need to be really careful as the health community when we're advocating for inclusion of health considerations in climate finance, that we're not diverting climate finance away from other sectors, because we know that action in those sectors is also going to have an impact on health. So if we look at mitigation and transport finance, just as an example, we can optimize that for health by making sure that rather than just investing in electric vehicles, that we also invest in active transport infrastructure, because in addition reducing emissions and reducing air pollution, that will also increase physical activity, it will reduce road traffic injuries, it will improve mental health. And so, like when we're thinking about how we can use health financing best for climate, when we're allocating finance for new healthcare systems and allocating healthcare budgets for the longer term, it's so vital to make sure that we plan for climate, and that means building and sustainable new healthcare facilities, revamping old ones to those same things, and looking at what projections of surgery for NCDs are going to be in future, and making sure that there is finance that is planned for with climate impacts and how that's going to affect NCDs. So I'm sorry that it took me so long to get to the bit that I think actually answers your question, but I hope that was not entirely irrelevant for the bits before.
Thank you, Jess.
Thanks, Jess. Anna Rakovac, please.
Yeah, thanks a lot. I have asked a question in the Q&As as well, because I wanted to know what is the GCHA's position on the carbon markets. To my knowledge, they're the biggest greenwashing effort globally, and something that really shouldn't be discussed. Am I missing something?
Great question. Jess, I think I will go ahead and take a couple other comments and then let you and other speakers come in. Courtney, you had a hand, but now you don't have a hand. Did you want to come in?
Oh, it was with regards to the surgical question. I do find that getting other physicians on board, as you know, this is still not in curricula. It was just October 28th that Canadian medical schools actually voted to mainstream planetary health and climate change in health. So most surgeons are still in the place of getting their own people on board with this work. And I agree that emphasizing acute care and really how many resources need to go right in order for someone to be able to show up and do an operation on a Tuesday. I was the Canadian Medical Association board member here for a long time, and that was actually the example I used. Because I find particularly people in high income countries, they have a hard time picturing dysfunction. And at the end of the day, it's the high income countries who need to be motivated to offer the money to climate finance and the rest of the world, who exert more power and have more control over multilateral institutions just by virtue of the way they were set up after the Second World War. So the two that I usually use are a C-section, because it's a very, very commonly performed surgery, and an appendicitis surgery, because that's something that young people get, that everyone has a family member who has had, and be like, look, if you want to be able to perform an appendectomy on a young 25-year-old at 7 a.m. on a Tuesday morning, you need to make sure that your ecological foundation is intact, your social structures are stable, and your infrastructure, your supply chain, and your medical workforce are healthy enough that they can arrive and have all of that go right. And so I find in terms of getting other physicians, health professionals, politicians on board, that's actually an excellent example, and then can feed into the rationale for work such as what Jess was presenting.
Thanks, Courtney. So we have a number of additional hands. We only have another minute or two for questions during this round. So I'm going to take as many as I can. Please keep your questions or comments brief. And if I don't get to you, we'll bring you back in the next round of Q&A. Kurt, please. Kurt Strife.
Yeah, I can wait until the second round. Thanks.
Okay. Bhupendra Rana, would you like to come in?
Thanks, Milena. Thanks all the speakers. My question for Jess is regarding quality. How quality is being leveraged for financing? Thank you.
Great question. Let me go ahead and take Robert Feder, your comment or question.
Thank you very much. I was wondering if there was any report on discussion of mental health issues at the most recent COP meeting. Specifically, there have been initiatives, a couple of different initiatives that are focused around resilience, that are supposed to be receiving increased attention at COP, but I didn't hear much about this. One of these is called COP Squared. The other is the International Transformational Resilience coordination by Bob Doppelt. So I'd appreciate hearing anything that people have to say on that.
Yeah, both great initiatives. Both great initiatives. Okay, let me take quickly a comment or question from Emmanuel Essio, and then we'll see if we can get a quick answer from one of our speakers. And move on. Emmanuel, please.
Oh, all right. Thank you very much for the great presentation so far. It's been novel, and I quite appreciate the effort of the GCHA. And my question is just very brief. And in what areas of inclusive mechanism that GCHA are going to use in order to engage the civil society organizations in their programs? Thank you very much.
So, Jess, do you want to come in with a quick response on any of those? We're sort of out of time for Q&A, but if there's any quick response that you wanted to give, please do. Or Jen,
yeah, I can actually come in really quick because I helped draft the point on carbon markets, and Anna, certainly, I think many people, including those of us on the GCHA staff team, wouldn't necessarily say that getting rules agreed on for carbon markets are a win, even though it was touted as a win in some cases, insofar as there are concerns around human rights and indigenous rights in relation to carbon market trading. And as you said, there are also concerns that this whole thing around turning carbon into something that we trade is a distraction from the meaningful phase out of fossil fuels that we actually need. However, I do think people, Article 6, which is the space where carbon markets have been negotiated, have been under intense negotiation for a long time. And I don't think that there was a scenario where we were going to see carbon markets totally decided that we weren't going to do that. They're part of the Paris Agreement. I think it would have been really hard to kill carbon markets because the train had left the station. And so what we got out of this COP was some agreement on rules. I don't think people are super happy with the rules, but it also does seem like the devils of implementation and how it's going to roll out and what that's going to mean for communities are actually still to be negotiated and figured out. So I think people were worried. It was they're signed off and done. And what I was reading and understanding recently is it seems like the negotiations and how this will be implemented will continue. However, some of the fights around carbon markets may move more nationally.
Thanks, Jen. So we're going to put a pin and a hold on the question about mental health and on the question about engagement, deeper engagement of GCHA, of bringing in civil society more deeply into this process, and come back to those in the next round of questions so that we can move on to our remaining speakers. At this point, I would like to turn over to Winnie Akeyo. Winnie Akeyo is a final year student pursuing an undergraduate degree in veterinary medicine at Makerere University in Uganda. Witnessing the complex interconnection between humans, animals, and the environment and the ripple effects of climate change on their health and well-being makes her advocate for a world where everyone is united regardless of discipline to address the various health challenges affecting our planet. She's a climate and health advocate and a member of the Youth Climate and Health Network, as well as the TARD Foundation. Over to you, Winnie, please.
Okay, thank you so much, Jenny, for this opportunity. At COP29, I was mostly following agricultural discussions. So I'm going to go straight into the discussion. The health relevance of agriculture. Agriculture is the core of global health and well-being, providing food necessary for human survival. But then the connection between climate change and agriculture is multidimensional, whereby agriculture contributes a third of global emissions, yet it still remains a very vulnerable sector to climate change because climate change is impacting food security, nutritional quality, and the livelihoods of smallholder farmers. And then also we are also seeing increasing risk of zoonotic diseases and AMR, which are closely linked to animal-based and industrial agriculture. We're also seeing worsening burdens of malnutrition, especially in developing countries, and diarrhea-related diseases, mostly in developed countries. So the expectations of COP29 are, we're seeing the unveiling of the Sharm el-Sheikh online portal. Apparently, there is only one formal negotiation track for agriculture and food systems under the UNFCCC, known as the Sharm el-Sheikh Joint Work on the Implementation of Climate Action on Food and Agriculture. We are also expecting to see indicators on global goals and adaptation related to food systems. And also another expectation, which is not on the negotiation track, the Ammonia for Climate Resilience Initiative launched by the COP29 presidency. On the issues of divergence, there was some resistance initially from Australia, Canada, and USA on the proposal that was brought forward by G77. G77 group was led by Kenya and Dominican Republic, whereby they proposed enhancing the portal to make it more usable, more searchable by region and theme, and to allow projects seek collaborations and funding, like the Adaptation Fund. But then later on, countries agreed, and Australia joined G77 to develop the online portal. Next slide, please. Let's go to the outcome. Yes, so the outcome we saw G77 and China, as well as Australia, developed a structure and submission portal, a submission template for the portal. And then also we saw so many indicators on the global goal of adaptation relating to food systems. These ones are so long that needs to be refined and agreed upon by parties. And then on the non-negotiation outcomes, we saw a very an agricultural breakthrough, whereby there were so many high-level events like the Global Methane Pledge, the water resilient food systems dialogue, whereby they were mentioning about agriculture. And then also the COP to COP Continuity Coalition highlighted the initiatives from COP 26 to 30, and Brazil promised to maintain food system at the heart of climate agenda in 2025. And then also we saw declarations, the COP29 declaration on reducing methane from organic waste. So far, there are 39 signatories, including the eighth of the largest organic waste methane emitters. We also saw COP29 declaration on multi-sectoral actions pathways to resilient and healthy cities, whereby there's a component of urban agriculture, and then the Baku Initiative on Human Development for Climate Resilience highlights the impacts of climate change on health, and then there's a part which talks about nutrition, especially on the climate change impacts on nutrition on children. And then also we saw a commitment by the World Bank whereby it reaffirmed the doubling of agriculture funding from 4.5 billion US dollars to 9 billion US dollars per annum by 2030. Moving forward, the next steps, we're seeing further development of the online portal by the Secretariat before the SBI meeting in Bonn in June, and then also preparation of the first annual synthesis report under the Sheikh El-Sham joint work by the Secretariat, and then also the first workshop on the Sheikh El-Sham, which will be on systemic and holistic approaches to implementation of climate action on agriculture and food systems and food security, understanding cooperation and integration into plans. And this will be held in June. And then also COP30 in Brazil, which is an agricultural COP. So the health community priorities, right now we should look at the workshop, which is in June 2025, next year, whereby it is accepting submissions from observers and parties on topics, speakers, and formats. So the submission is open till 1st of March 2025. And for the health communities, we're suggesting we should focus on nutrition, food security, and healthy diets, healthy sustainable diets, and reducing food loss and waste. For the health communities, I mean, that's where we should put our focus on, as anyone who is going to make a submission on this workshop. And then also we should continuously advocate for the inclusion of health core benefits in agricultural decision making in our NDCs and National Adaptation Plan. And then also we should promote and encourage cross-sectoral approaches. That's the One Health approach to overcome some of the agricultural health-related issues like the AMR, the zoonotic diseases. Yeah, thank you. Back to you, Jenny.
Thanks so much, Winnie. Great overview of the agricultural dimension. So moving quickly on, I'd like to turn to Dr. Logan Harper. Logan is a family physician and a climate and health science policy fellow at the University of Colorado. As part of his fellowship, he collaborates with GCHA to advocate for health-focused international climate policy. Over to Logan to talk to us about a just transition at COP29.
Thank you, Jenny, and apologies in advance if I have to stop and cough or clear my throat. I'm recovering from a cold. Moving quickly to the health relevance of the just transition discussion at COP. Just transition is a very intersectional topic, and the health relevance is related to that of all the topics that we've already discussed. So as we know, fossil fuels are harmful for the workers, harmful for frontline communities, and harmful to everybody who has their health impacted by climate change. Transitioning away from fossil fuels is key to mitigating those health outcomes. And then again, everything we've discussed already is relevant to just transition. So that includes things like adaptation, resilience, and loss and damage. The just transition is prioritizing an eradication of poverty and economic equity across the globe. And of course, we know that poverty is associated with poor health outcomes, and fighting it is essential to achieving health equity globally. And then last point, transitioning away from fossil fuels is expected to result in a net job gain but there will also be 80 million existing jobs that are lost. So depending on where the new jobs end up, it could risk furthering inequality if those fossil fuel workers aren't provided with alternative economic opportunities. And then we know that that inequality leads to bad health outcomes. So the expectations at this COP included building on the landmark Just Transition Work Program text, which was first adopted at COP28. And this was such a landmark text because it was the first time the UNFCCC has formally recognized labor rights and their role in terms of climate policy. The hope was that at this COP29, we would be able to identify and enable specific means of implementation with a heavy emphasis on funding from the global north to allow for means of adaptation and mitigation in the global south. And then many hoped for increased prioritization of mitigation in the Just Transition text specifically, as well as expanded references to human rights. All of those things became issues of divergence. The first thing I want to highlight there is that just the lack of progress on the NCQG, the unwillingness of the global north to come to the table with concrete funding numbers, this really impacted the Just Transition negotiations. And there was a lot of discussion, a lot of focus from the low and middle income countries in the Just Transition negotiations about getting funding from the global north to provide for the means necessary to have a just transition. And that sort of leads into the issues of domestic responsibilities versus international cooperation. So a lot of countries from the global north in particular were very focused on including specific criteria and steps that each country must meet in order to be considered keeping up with the requirements for just transition. Many people from the global south and sort of excuse me, would not agree to those sort of requirements and felt that an emphasis on what they termed international cooperation was much more important, and that anything that constituted, requirements domestically was really a top-down attempt by the international order and the global north to sort of control what a just transition would look like for them specifically. And by international cooperation, what they mean really is funding from the global north for the initiatives that they need within their specific country, as opposed to being told what to do by the UNFCCC. Another major issue was the perception that some parties were trying to renegotiate the COP28 agreement and erase the common but differentiated responsibility provisions. And so a lot of that was wrapped up in whether or not to include the global stocktake within the text for just transition. So the global south often felt like, many countries from the global south felt like including domestic responsibilities in terms of mitigation was expanding the scope of the just transition text, and that was considered renegotiating in their minds. And then there was the issue of adaptation versus mitigation. So many countries from the global south, led by the G77 plus China, really favored a heavy focus on adaptation within the just transition text as opposed to mitigation, whereas many countries from the global north and other countries in Latin America, small island states, all had a focus on including the 1.5 degree target as part of the text. Next slide, please. As far as concrete outcomes, the text negotiations stretched on beyond the deadline, and so ultimately no consensus was agreed upon for a new text. The deadline for negotiations was meant to be the end of the first week. Nothing could be agreed upon. And then during the second week, the presidency really did not support any new meetings until the second to last day of the conference, at which point multiple new versions of the text were released. But too many countries felt like those versions did not represent the concerns that they had voiced, and so no consensus was agreed upon. I will highlight that the draft text mentioned the right to health, right to a clean, healthy, sustainable environment, access to affordable, renewable energy, and then also socioeconomic opportunities from the transition away from fossil fuels. So lots of potentially good progress that unfortunately could not be agreed upon. So next step, of course, is at Bonn, we need to prepare a just transition text that hammers out a lot of these areas of disagreement and can realistically be adopted at COP30. And then a lot of observers are expressing hope that the Brazilian presidency will be effective at prioritizing this issue and providing guidance that hopefully will help us agree on a new text. Some areas that the health community can focus on. The new text really needs to include reference to the right to health and the health benefits specifically of transitioning away from fossil fuels, rejecting economic inequity and prioritizing necessary financial support from the global north, as was universally called for by the global south during this COP, including language from the GST as far as the energy transition. I wrote paragraph 35, but I believe it's 28. That is essential for the mitigation component, which should not be left out from the just transition text. And then NDCs need to reference the just transition as well. Currently, only 23% of them do. And then we need country-specific means of implementation. This shouldn't be top-down. This should be something that every country can really, identify what they need to have a just transition and what that means for them. Thank you.
Thanks so much, Logan. And without much ado, we're going to transition over to Niona Kasekende, who will talk to us about the gender outcomes on gender from COP29. Niona is the Gender, Health and Environment Lead at Regenerate Africa. She is a reproductive health expert and a public health enthusiast by education, currently pursuing her master's in public health. She's a green project manager by training and a health, gender, and climate change advocate by passion and profession. So over to you, Niona.
Thank you so much, Jenny, and thank you to the previous speakers. So in regards to gender, I think we already see that there are already existing vulnerabilities, especially among women, children, and young people when it comes to their basic living. So these vulnerabilities, of course, look at, for example, the access, utilization, and control over productive resources like land and probably income. But then when we look at issues related to climate change now heightens these already existing vulnerabilities, which creates a need for us to actually look and address them. But specifically the gendered impacts, the gendered health impacts that are brought about by climate change are disproportionately affecting women and girls, especially when it comes to aspects of food security. I think my friend Winfred has already talked about malnutrition and how that definitely affects pregnant women and children. And then issues of extreme heat that are definitely causing poor pregnancy outcomes, like we've seen research on how extreme heat has led to what we call, so extreme heat leading to poor, maybe macerated births or stillbirths, but we've also seen it being related to early births and low birth weight, but also disaster-related injuries and mortality, basically affecting women because they not only have to take care of themselves amidst climate-related disasters, but are also supposed to take care of their household members. So that leaves them at a risk of being more at risk of experiencing these disasters and their impacts, but also access to health services. We've seen as research on menstrual poverty and experiences around menstrual poverty where in cases, for example, of drought leading to sort of like limited access to safe and clean water. So girls cannot be able to access clean water during their menstrual periods, but also accessing menstrual services, but also exposure to violence. Like the more that resources are not available due to like maybe droughts, women have to move longer, women and children have to move longer distances to look for food, water, but also energy, because majority of, for example, countries in the global south use fuel for now. So that exposes them to perpetrators in that scenario, creating challenges around their reproductive health and care. But also for more information, I've linked a report that I think can provide more details about this nexus between gender health and climate change, but there is also a lot of research out there that talks about the same. So as we're heading to COP29, we expected to see the final review of the 5-year Enhanced Lima Work Program and its Gender Action Plan to assess progress, challenges, and priorities. So the Lima Work Program basically is sort of like a framework that tells us that enhances gender decisions within climate policies, within the UNFCCC processes. And the Gender Action Plan is how the Lima Work Program is implemented. So it looks at the detailed actions, the timelines, and who is responsible. So we expected a review of those two documents. And we also expected the means of implementation of the new Gender Action Plan to be clearly stipulated. As with means of implementation, I think someone already mentioned, a previous speaker, that we look at finance, capacity building, and technology. So under this, they were basically stating that developed countries should provide support, that is financial support, new and additional financial capacity building and technological support to developing countries to be able to meet their climate ambitions, but also in relation to implementation of their gender action plans. So we expected language around that, but we also expected support for the gender and climate change focal points to carry out their mandates. That is because these people, the focal points in our different countries that talk about gender and climate change that need to attend these SBs and the COPs, sometimes we don't have the financial resources and also the technical resources to be able to represent our countries very well. So they needed more support in that aspect. And then around issues of divergence, there was sort of like contention when it came to the duration of the Enhanced Lima Work Program and its Gender Action Plan. So the Lima Work Program has moved from a 2-year to a 5-year now, and then it has been extended to a 10-year Lima Work Program. And then the Gender Action Plan was now moving from a 5-year, and countries were talking about it also being a 10-year Gender Action Plan. But some countries like Zimbabwe came up and said, if we have a 10-year Gender Action Plan, it's going to be very hard for us to change decisions. What if we've made the wrong choices? What if we picked the wrong themes? What if we picked the wrong objectives and then we have to wait 10 years to create a new one? So they suggested for it to be a 5-year Gender Action Plan, but of course some of these were not agreed upon. So we'll be waiting to see how long the Gender Action Plan is going to be as of maybe SB 62 and maybe COP30. But the Enhanced Lima Work Program, I think for it was decided on that it will be they will have a 10-year extension. And then the deletion of Para 7. So Para 7 basically talks about looking at the aspects of the Lima Work Program and Gender Action Plan under the Paris Agreement. So some countries like Russia, China, Zimbabwe, Uganda, and the G77 and China were not agreeing. They wanted to delete that paragraph because they felt like the Paris Agreement is not legally binding, so developed countries would not be obligated to support developing countries to be able to meet their ambitions in relation to implementation of the Gender Action Plan and its Lima Work Program. But however, countries like Australia, EU, and USA and Chile were in support of not it being done under the convention. So you'd see that the countries that would contribute the money were now the ones that were for the inclusion of these documents under the Paris Agreement, so they would not be held liable towards making the payments that are required. And then also the provision of finance, definitely to ensure full, meaningful, and equal participation of women. So one thing I have to tell you is that during the formulation of the COP29 Presidential Committee that was going to host us, it was made of 28 men with no woman at all, until some strong, activists came up and said no, and the COP29 presidency had to relook and rethink and then include, so they included 12 women at least. So women need to be fully participatory, and this participation is hinged on finances majority of the times. The women with great ideas that need to participate in these processes, that need to come on board, but because they don't have the finances, they may not be able to participate. So countries were asking for financing and technical support for these women to fully participate. For example, Gambia, Nigeria, South Africa, and amidst other countries, these were just the ones that really were voicing their thoughts majority of the times. So versus Australia and the US, which were saying that maybe we don't need to provide financing, but we realize that financing can enhance participation. So we also had contention around the issue of language on human rights and diversity, equity, and inclusion. When it comes to equity and inclusion, there was statements that were made in relation to men and boys being looked at as allies in all their diversity, men and boys in all their diversity, and the empowerment of women in all their diversity. So the fact that they were stating in all their diversity, that I think included aspects of minority populations, which some countries like Russia and Indonesia did not agree with. So that text has actually been deleted. And unfortunately for some people in some countries that are really affected by this, so it has a very big misstep in these COP29 negotiation processes. Next slide, please. So for the COP29 outcomes, we've already talked about the enhanced Lima Work program being extended from 5 years to over a period of 10 years, to a period of 10 years. And also the fact that for the first time ever, they have encouraged gender and age data, disaggregated data in existing policies. So for policies that are already existing, but also in the new policies and programs, we have to collect gender and age disaggregated data. And this would be very important, especially for measuring, for example, the target under the Global Goal on Adaptation, para 9C on health. If we get gender and age disaggregated data as we're measuring those indicators, that would still be great. And then for the UNFCCC Secretariat, was encouraged to ensure that all budget proposals have considered effects on gender equity, which was a plus for us. And then easily accessible gender responsive finance and scaled up support for developing countries to implement the enhanced MARC program, and also the new gender action plan that's going to be developed. Countries, of course, different parties were encouraged to appoint and provide support to their national gender and climate change focal points, so that they can be able to easily participate in negotiations, implementation, and monitoring of UNFCCC processes. But also parties were encouraged to report on the progress of the Lima Work program and the new gender action plan under the UNFCCC processes in the future. But also, I think there is something that was mentioned in the chat around the mention on health. So health was mentioned once in the text, and that was, of course, they were looking at it as one of the areas that should be considered, and they were emphasizing the promotion of human rights and the promotion of health rights as well. And then the next steps at SPI 62, there is going to be a session on the development of the new gender action plan activities, and the gender action plan will be adopted at COP30. So anyone who wants to share or provide submissions on how this in-session technical workshop will take place, you can feel free to submit via that link, and the deadline is 31st of March. So you just have to share on what is the scope that you would want to be covered, what are the themes, objectives of the meeting, and also the format in regards to how do you want it to be done as well. And then for the health community priorities, definitely we need more research on the gendered climate change implications on health to support evidence-based advocacy, but also to come up with messaging for the gender people. How do we best include health, the health considerations into gender and climate change conversations, and then integration of health considerations into the new gender action plan. So specifically under the different things that will be designed, it would be important for us to weigh in our thoughts on how we'll better be represented. And also for country efforts, this is a call to the people in the different countries we're all located in. Let us try as much as possible to reach out to the national gender and climate change focal points and build their capacities on how best to integrate health, so that in the future, as they're talking about gender, it will be a good entry point for health to be discussed if they are aware and their capacities are built in this regard, but also for the upcoming review of the NDCs, or the nationally determined contributions, in February next year, and the formulation of the NAPs for some of the countries that don't have those yet. It's important to, as we're looking at the gender considerations as well in these documents, we also look out for the health considerations in collaboration, I would say. So thank you so much. I think that is it from me.
Thank you, Niona. And if folks have questions for Niona, please feel free to share those in the chats, or if we have time at the end during our final Q&A. So I'm now going to turn over back to Jess Beagley to share with us. So what we've been covering so far are the outcomes from the negotiations that happened at COP. There's also a lot of work that happens kind of in the context of COP that is not the official political negotiations. Jess is now going to walk us through the health-related announcements that happened during COP29. Over to you, Jess. And then we'll also hear from Jen Kuhl about what we're looking at going forward from here.
Thank you, Jenny, and thank you, everybody that's spoken. It's been really wonderful to learn from you. I'll turn my video off actually because my video just froze for a moment, so hopefully my connection's okay. Please post in the chat if it's not. But for some of the non-negotiated health announcements that we heard from, just to flag a few, because there were many, we saw the formal announcement of the Baku COP presidency's Continuity Coalition for Climate and Health. This will bring together the presidencies from COP26 through to COP30 to look at how health can be more consistently integrated in the UNFCCC space. This will mostly relate to the action agenda, so not the negotiations itself. Also on Human Development Day, which included a focus on health, the presidency launched the Baku Guiding Principles on Human Development, with particular emphasis on the need for more investments in the health and the education sectors. WHO produced a really wonderful report on health and climate change. We've seen previous iterations at COP24 and COP26, and this latest one was specifically for COP29 and would really recommend to people to read that. With attention turning to nationally determined contributions, the deadline for the next NDCs, which are national climate commitments to deliver the Paris Agreement, those are due in February 2025, and WHO has produced some really excellent quality criteria for how health can be integrated. For the on urbanization, there was the COP29 declaration on multi-sectoral action partners to resilient pathways, to resilient and healthy cities. We saw the Friends of Climate and Health have its first outward-facing event, the first meetings of the Friends of Climate and Health, which is a platform, a network participants from governments in the UNFCCC negotiations to come together and discuss how health can be more embedded in the negotiations. They've been meeting since Bonn, but we had the first outward-facing event in Baku. And finally, we've got health continuing as a target in the Global Goal on Adaptation. That is part of the negotiations rather than the non-negotiated items. And I'll stop there and hand to Jen. Thank you.
Thanks so much, Jess. And Milena, I wonder if you could just unshare and reshare and see if we can get rid of these strange lines that have shown up. But in the meantime, wanted to reflect on this was certainly a frustrating COP in terms of process terms of process. We've heard many people mention that what was being asked for and what is justly owed as a debt, a climate debt from the wealthy polluting nations who have been extracting and using resources that have heated the planet for decades, what they owe the countries who are being harmed by this crisis, that those amounts were not met. And I think that that's deeply frustrating. And we saw that raise some concerns about what that means for COP overall. I think that there are certainly calls to reform the COP. I think what we really feel is it's the UNFCCC is the one process where we have we have countries from all over the world working with each other. We have a legally binding agreement in the Paris Agreement, and it's really important not to lose that. So I think there is ongoing work from the UNFCCC, from civil society behind the scenes to try to see if there's ways that COP can work better. But we're wanting to walk that line between this process is frustrating and it's important to keep countries accountable to the agreements they've already made so we don't backslide. Okay, great. We've also, I think, growing concern about the presence of the fossil fuel industry at COP. There is a campaign called Kick Big Polluters. We've also got the Fossil Fuel Non-Proliferation Treaty presenting themselves as sort of a secondary pathway, so a complement to the Paris Agreement. I think that if you keep your eyes peeled, there's some exciting announcements coming from the treaty this week, looking to figure out an agreement about how we transition away from fossil fuels to economies that serve the health of people and the planet better. Wanted to highlight again that this continuity coalition kind of does us this enormous favor in that for many years, health was advocating to be at the table in a consistent way at COP, and the continuity coalition, part of the goal is to ensure that health continues to be in the conversation in a meaningful way, building on the work that has been done. And I think the WHO has stepped up to host that, and that is exciting. I also think that COP is certainly not the only way to make change on, like COP and the UNFCCC are not the only or even necessarily the best way to advocate for action to address the climate crisis. You can engage in the processes to develop the nationally determined contributions that are due this year. And I think that there are ways that health being included and considered in those documents can push for more ambitious action on adaptation and mitigation. But there's also ways that your national policies on, fossil fuel advertising or on your local policies on transportation, getting involved in your city government's regulations about gas stoves, all of those things really matter in the bigger process. So just because we are focusing on COP now doesn't mean it's the only way to go forward. Next slide, please. There's a couple things to put on your radar. The WHO Civil Society Working Group on Climate Change and Health is pulling together a task force to bring civil society in conversation with the Continuity Coalition. As per last year, Forecasting Healthy Futures is going to host a summit in Rio. They've done this the last couple of years, hosting a summit earlier in the year. And we will certainly be at the subsidiary body meetings in June. Again, the UNFCCC doesn't have to be for everybody, but if you want to be there, you can be there. We've only got about 4 minutes, and so I don't know, we can do some answering of questions in the chat. I don't know if we want to take 1 or 2 more. Kurt, I feel like we should take your question because you kindly took a pass.
Thank you, Jen. In fact, my question is right now much better questioned. And so far, there was some mentioning of specific indicators in adaptation, but not in mitigation, which is my kind of favorite topic. And is it too early to discuss indicators for mitigation with regards to health, of course? Or would it perhaps even advance negotiations if we come up with specific indicators instead of just kind of broad top-down? Is it better to do this with the NDCs 3.0, or should we do it at push forward as much as we can at SB 62? Would it be better placed in just transition, or should we? It's a difficult question about strategy forward and what's most efficient. So I'm not sure who can answer.
I can take one part of that, which is the indicators we're talking about around the global goal on adaptation are because for mitigation, we have the 1.5 degree target that can be global, but in adaptation, we can't have that. And so the indicators have been sort of how we measure our progress towards a global goal on adaptation. So the need for mitigation indicators individually broken down by sector has been less. Jess, I don't know if you want to come in on the other parts of that question.
I think I probably haven't got a good enough answer to it to answer live, so really happy to follow up with Kurt after. And sorry not to have a better answer right now. But
no, it probably also requires more a kind of a strategy discussion rather than a quick answer, yes, no.
We have time for one more comment or question. before we wrap up? Okay, if there are no more comments or questions, we're going to I'll go ahead and officially close the meeting at the designated time. I want to just reemphasize a couple of points. One, the importance of these high-level multilateral processes. They are really important. They are places where all countries have a seat at the table and have come together to make important agreements. Secondly, there is a real problem having the influence of industry so deeply embedded in these processes, and we need to be working together to drive that industry influence out, that conflict of industry out of these spaces. Thirdly, I also would really like to reemphasize the point that the work to make change for a healthy and sustainable future for all of us does need to happen at all levels. COP is a really important space, but it is by no means the only important space. And moreover, as Courtney said at the opening, success in that space depends profoundly on everything that happens at all the levels up and down, from the very even hospital level to community level to state or province, nation, region, etc. So unless we're all moving the needle in those arenas, we will not have the political will at the international arena to get the job done. So there's a lot of work ahead for all of us. This was a very frustrating COP. There were a few bright spots in it, but overall, we did not make the progress we needed to make to deliver the future we want. Our work is cut out for us. I know together we can make the changes we need to change. So again, thank you to everyone who joined us. Thank you to all our excellent speakers. And we look forward to working with you in 2025 on this really important issue. Take care and have a good rest of your day.
Thank you. You too.
Thank you. Take care.
Bye. You've done novel. Thanks for the session.
Thank you.